The Perelman School of Medicine is introducing CARE-7, an exciting new curriculum about palliative care. Students will dive deep into this medical specialty designed to enhance quality of life for patients with serious illness. Our goal is to develop physicians who can communicate with these patients and with their families and provide the highest quality, life-prolonging medical care, while also improving patients' quality of life and providing highly compassionate, individualized care for each patient and support for their families.
The CARE-7 curriculum is made possible by the support of a very generous donor. CARE-7 is named for the 7 learning domains that include knowledge about palliative care, compassionate and effective communication, and pain and symptom management. We know that every physician will care for patients with illness that impacts their quality of life. It is therefore crucial that every physician develop a robust skill set in these areas.
CARE-7 introduces core concepts early on in the pre-clerkship years, including an immersion experience in clinical palliative medicine. In the clerkship year, clinically relevant skills are introduced that students can then use in patient care. In the post-clerkship years, we tailor the training to students' areas of interest and focus on more advanced skills.
The hospice and palliative medicine experience is a wonderful opportunity for students during their preclinical years to have exposure to the field of hospice and palliative medicine. One of the best parts of the hospice and palliative medicine experience occurring so early on in all of students' medical education is that it exposes them to the range of activities that take place in palliative care. And I remember in my own experience getting to accompany a physician as she had a goals of care conversation with a patient, and just to see the look of calmness and comfort that came over the patient's face when the physician accompanied and listened and really prioritized the patient's values was something that for me was a very transformational moment in understanding the importance and the power of palliative care for all physicians, regardless of what specialty we go into.
Students on the surgical services perform a palliative care assessment on one of their patients, and I think it really helps ground them and allow them to understand the nuances of all of their patient and really learn to deliver a care to the entire patient, not just a small aspect or a surgical aspect of their care.
The Palliative Care Skills Practicum Day is a full day during the clerkship year focusing on communication skills and pain and symptom management. Students bring their experiences from their rotations thus far and leave with a more advanced skill set that they can incorporate during the rest of their clerkship year. These are really practical skills that students will use on a daily basis for the rest of their careers.
I really enjoyed the session on pain management because I felt it was really practical for us going into the clerkships. I think before that session we had heard a lot about the different medications you can give, but we didn't know exactly why someone would choose one thing over another and what the considerations would be for that particular patient or for that particular medication. So I thought getting to go through a bunch of different cases and figure out why you should use one medication and what you would be considering when you're trying to help out your patients, I thought was an extremely useful skill that I used a lot in my following rotations.
Excellent communication skills require deliberate practice to improve, just like any other procedure. CARE-7 uses trained faculty and simulated patients to create an environment for students to practice these skills in a safe space that's really tailored to the individual learner. We think of it like a communication playground where students can feel comfortable trying new ways of communicating, finding their learning edge, and getting feedback from expert coaches. The idea is to create physicians who can engage authentically and create strong relationships with the people they're caring for.
I've used a lot of the skills that I was able to begin developing during the practicum day on my clerkship experiences since then. I'm on my OBGYN rotation right now, and patients will often ask, is this going to be okay? Should I be concerned about this? And sometimes I don't know the clinical answers, but from the training sessions, I kind of am able to hone in to the fact that patients are really asking an emotional question. They're saying that they're worried, they're saying that they're afraid, and I'm able to address that and say, you came to the right place for care, we're glad you're here, we're going to take great care of you, and we can answer the clinical questions as they come up.
I think the students will use these communication skills far and wide throughout their career. It is not just a surgical patient where this is really going to be relevant. Really, every patient that we interact with, we need to communicate effectively. And I think these skills will be a lifelong tool that they will continue to use.
I'm so excited that we have a palliative care curriculum at Perelman. I don't know that I'm going to become a palliative care physician, but I know that I'm going to use these skills no matter what type of medicine I practice. I think understanding the fundamentals of palliative care, understanding how to address patients' emotional concerns, understanding how to develop our own coping mechanisms and resiliencies, those are skills that I know will serve me well throughout the rest of my career in medicine.
I think a palliative care curriculum is vitally important to teach our future doctors how to really approach the total patient. So much of medical education is focused on the discrete aspects of a medical disease process, but really understanding palliative care is to understand the entire patient and to approach their care with the patient in mind and not a diagnosis.
It's so important that in addition to learning how to provide life-prolonging care, we are also learning the skills to improve patients' well-being and walk with them as they cope with the challenges of illness in every phase of life.